I now recognize the gentlewoman from California, Ms. Chu, for 5 minutes.
Well, first, I just have to make a statement in response to what was said earlier. Yes, God makes no mistakes, and that means that transgender kids are not a mistake and deserve our support to be who they are. Well, turning to a different subject, what I came to ask about, which was Secretary Becerra, wonderful to have you here today. I wanted to ask about reproductive choice. And first, I'd like to thank you for working with the President to once again deliver a budget request free from the harmful and discriminatory Hyde Amendment. Instead, this budget rightly includes significant funding increases for the Title X Family Planning Program and the Teen Pregnancy Prevention Program, both of which help our most vulnerable access the reproductive health care that they need. So I wanted to ask about the Medicaid free choice of provider requirement. We have a disturbing trend in recent years where extreme Republican governors and state legislators have taken action to deny Medicaid patients their legal right to seek services from the providers of their choice. States such as Missouri, Arkansas, Mississippi, Louisiana, and South Carolina have instituted bans of state Medicaid funds going to all eligible family planning providers. Courts have even issued injunctions in several states to stop such bans. Can you discuss HHS's plan to enforce the Medicaid free choice of provider requirements so that everyone can access services like contraception, STI testing, and reproductive counseling at the provider of their choice?
Absolutely, Congresswoman. Please make sure you say hello to everybody back home that I don't get to see much these days. We have to, as I always say, it's our job to comply with the law and enforce the law. One of the laws that we have in the books is that if we're offering family planning services, it's available to anyone who's qualified to offer family planning services. And that means people who are the beneficiaries, the individuals who need those family planning services should have access to those programs. We should not be restricting them because we don't like what else they might do beyond that family planning service. And so we're going to simply enforce the law, make sure that we're in compliance with the law, and make sure, as you've said, and thank you for the work that you've done on this, to make sure Americans have a choice of going to a provider that can provide them with that family planning service.
Thank you for that. And I want to say that one of the benefits of the Affordable Care Act's birth control benefit was that everyone could access the contraceptive method of their choice cost-free. However, this promise has unfortunately not been realized for many, even those who have insurance. Some health insurance companies are still imposing out-of-pocket costs on birth control, which is in direct violation of the law. When they don't comply with the law, the impact is greatest on people for whom even a small copay for birth control is too great a barrier between them and the care that they need. And that's why I was proud to join Representative Lois Franco in sending you a letter requesting that your agency, along with Treasury and the Department of Labor, enhance your enforcement actions and improve public awareness around the ACA's contraceptive requirement. Secretary Becerra, I know you have experience with this from your time as our state's Attorney General. Can you discuss how HHS plans to ensure insurance companies are complying with the law and that the public is aware of their rights under the ACA? Will patients be the ones responsible for reporting violations, or will HHS proactively be investigating plans to ensure compliance?
Congresswoman, we're taking proactive steps to make sure that those providers and those insurers who are out there receiving federal support for their work understand their obligations under the law to make sure that services that are provided for under law under the Affordable Care Act are made available to anyone who qualifies, and that of course includes women and contraceptive services. So we're going to double down on this to make sure that we both inform providers of their responsibility and make sure that we hunt down those who are violating the rights of Americans to access the services they're entitled to under law.
And let me thank you for your leadership in ensuring Title X Family Planning Program. This is the nation's only program dedicated to providing family planning services for people with low incomes, but has been underfunded for a decade. The budget finally invests $400 million for this program, which is the highest funding in the history of this program. So I wanted to make sure that everybody knew that that is in this budget, and it is a great thing for the women of this country. Thank you.
Thank you.
Gentlewoman's time has expired. I now recognize the gentleman from Iowa, Mr. Feenstra, for 5 minutes.
Thank you. Thank you, Chairman Yarmouth and Ranking Member Smith. Secretary Becerra, thank you for being here. I appreciate your comments.